We hear a lot of other things about public health. Well, here are some facts. EDI reports push back on activist alarmists, anti-oil and gas impact rhetoric. A report reviewed and publicly available data from the Colorado Department of Public Health and Environment, CDPHE, including epidemiological health studies and air sample studies for Weld County, Colorado, where nearly 90% of the state's oil and 40% of the natural gas occurs. General findings of the report are that while oil and gas development skyrocketed in Weld County from 2002 to 2015, with nearly 24,000 active wells as of February 2018, data shows that the rate of death for cancer, heart disease, and chronic lower respiratory disease in Weld County decreased over this period. So let's not buy that argument. This is about health and safety. The report was released by Denver-based Energy and Death Mountain States, EID, a research, education, and outreach program. They're the ones that funded this report. Weld County numbers. Despite a growing elderly population that nearly doubled in just 13 years in Weld County, every major health indicator appeared to improve at the same time. Oil and natural gas production was rapidly expanding across Weld County. This while the number of productive wells in the county increased nearly 117%, from 12,481 by the end of calendar year 2002 to 27,063 by the same time in 2015, according to the data compiled by COGCC. According to COGCC, from 2002 and 2015, natural gas production in Weld County increased from 184 million to 552 million cubic feet annually, a threefold increase. Oil production increased nearly 12.3 times, from 8.9 million to 109 million barrels per year. Active wells in Weld County account for approximately 43% of the state's total, up from 38.2% in 2006. And the county's number of active wells nearly outnumber the next 5 largest Colorado counties, aggregate active well count: Garfield, Yuma, La Plata, Los Animas, and Rio Blanco combined. These findings are consistent with the data obtained in the other areas of the county. For example, in 2001, analysis examining the effects of natural gas development in Denton County, Texas, concluded that even as natural gas development expanded significantly in the area over the past several years, key indicators of health improved. They improved as the gas drilling expanded across multiple categories studied. A separate analysis found a decline in mortality rates from lower respiratory disease in some of the largest natural gas producing counties in the Marcellus Shale region. CDPHE's findings, not necessarily bastion of conservatism as far as state agencies go. CDPHE scientists have reviewed 12 relevant epidemiological studies covering 27 different health effects in communities near oil and gas operations and found no substantial or moderate effect on any health effects on people. CDPHE ranked the majority of recent studies purporting to find a link between oil and natural gas activities and adverse health effects as low quality. So these other reports are low quality, primarily due to limitations of the study, designs that make it difficult to establish clear links between exposures to substance emitting directly from oil and gas and the outcomes evaluated. CDPHE's review found that studies of populations living near oil and gas operations provide limited evidence of the possibility for harmful human effects. CDPHE's analysis noted that the individual's total exposure may reflect multiple substances from both oil and gas and non-oil and gas sources from indoor and outdoor environments. For example, VOCs, volatile organic compounds, can be emitted from a variety of sources, including oil and gas, and other industrial operations, vehicle traffic, and everyday consumer products such as nail polish, detergents, sealants, aerosol, antiperspirants, and deodorants. So I think we need to start a bill to ban those products as well. A CDPHE report that analyzed more than 10,000 air samples in the areas of the state where substantial oil and natural gas operations occurred found that levels of emissions were safe, even for sensitive populations. Based on currently available air monitoring data, the risk of harmful health effects is low. I'll repeat that, is low. Based on currently available air monitoring data, the effects are low for residents living near oil and gas operations, with CDPHE authors concluding that this time results from exposure and health effect studies do not indicate the need for immediate public health action. Again, at this time, results from exposure and health effect studies do not indicate the need for immediate public health action. again from CDPHE. CDPHE statements. Former CDPHE Executive Director and Chief Medical Officer Larry Wonk has said, there's no reason to believe that there is a causal relationship between oil and gas operations and chronic disease or cancers. Former CDPHE Director again and Chief Medical Officer Larry Wonk has noted that despite alleged claims of oil and natural gas development causing health risks, Colorado Health Department found that development has not adversely affected the health of Weld County's 200, and this has been 2016, 285,000 residents. Mr. Mike Van Dyke of CDPHE, our current report has two pieces. The first part is essentially all the air samples that we could find that were taken in the areas near oil and gas. And we really, in a conservative way, took the max concentration and the max average concentration from those data sets and compared them to what would we be called safe levels by the U.S. EPA or by other states. If the EPA did not have a value, what we found was that, based on these data, there was no chemical or substance that exceeded those safe levels. Mr. Van Dyke of CDPHE again has said that the often cited leukemia study by the University of Colorado professor and researcher Lisa McKenzie had significant limitations and constituted research that suggests more research needs to be done, not research that definitively links oil and gas exposure to cancer in the age group. Former CDPHE Executive Director and Chief Medical Officer Larry Wonk told the Denver Business Journal that McKenzie's conclusions were misleading. Based on the study and other studies, data information we have to date, we find no increased risk for childhood leukemia, especially when considering the current setbacks of a minimum 500-foot buffer between oil and gas wells and homes. Wonk wrote to the Denver Business Journal, upon the report's release last February, Wonk said CDPHE saw no increase in leukemia in oil and gas developed countries, or counties, versus those that don't, and versus statewide expected averages. Why these numbers matter? Activists make unsubstantiated claims at the state legislature. Claim, a University of Colorado Public Health study authored by Lisa McKenzie shows that babies who live near oil and gas wells are likely to be underweight, have asthma, lower future test scores, and increased risk of acute lymphoma anemia. Fact, Dr. Larry Wonk, Chief Medical Officer and Executive Director of the Colorado Department of Public Health, said of the report, the study conclusions are misleading, and the study questions a possible association between oil and gas operations and childhood leukemia. It does not prove or establish such a connection. Claim, loads of government research centers in Colorado, state and federal, say that drilling needs to be limited because emissions from extraction process are contributing to health problems. Here's the fact. Again, Dr. Van Dyke of CDPHE, our current report has two pieces. The first part is essentially all the air samples that we could find that were taken in areas near oil and gas, and we really, in a conservative way, took the max concentration and the max average concentration from those data sets and compared them to what we would call safe levels by the U.S. EPA or by other states. What we found was that based on this data, there were no chemical or substance that exceeded those safe levels. Claim, the American Lung Association gives Fort Collins an F for air quality and oil gas illnesses. Fact, in 2014, the Colorado Department of Public Health and Environment, CDPHE, warned that American Lung Association's air quality report card was both inaccurate and misrepresented air quality in Colorado.